Welcome to Conversations That Matter, a policy-driven conversation with local leaders to discuss the issues that most affect the quality of life of Kern County residents. I'm your host, Michael Turnipseed, Executive Director of the Kern County Taxpayers Association. Our guest today is Brynn Carrigan, Director of Kern County Public Health. Welcome.
Thank you for having me.
So tell us who Brynn Carrigan is and how you ended up in your seat as Director of Public Health of Kern County.
Sure. Well, I'm a Kern County native. I was born and raised right here in Bakersfield. I'm a product of our public school system, a graduate of South High School. Did my college stint right here in Bakersfield at California State University and have spent my entire professional career with Kern County. I've worked for a number of different county departments and a number of different administrative roles, all really giving me the experience needed to run a large-scale department like Kern County Public Health. I've been with the department now for 10 years. I spent about 8 of those 10 years serving as the Assistant Director for Kern County Public Health, and 2 years ago in March, I was appointed by the Kern County Board of Supervisors as the Director of Kern County Public Health.
Wow. So you've been around, you've been in a lot of rodeos. What do you really want to accomplish as the Director of Kern County Public Health?
There is so much I want to accomplish. I was lucky enough to get to launch many different programs as the Assistant Director with Public Health, programs that really help our community access fresh, healthy, wholesome foods, learn how they can exercise within their own homes and live an overall healthier lifestyle. I'm now ready to continue those innovative programs that can really educate our community on how they can live better and longer and have a better overall quality of life. I'm really looking forward to that. We have some really difficult health outcomes that we face here in Kern County, and I hope that at the time that I'm retiring from my position, that I'm able to say that I made a positive impact on those health outcomes, that we made a difference as a department in the way our community lives and how long they live and how good their life was while they were living.
Wow. You came in mid-pandemic. The worst time anybody would ever want to get a public health job. So coming out of this, how are you transitioning from that time into this time, and what have been the successes and what have been some of the failures in this transition?
It was absolutely some of the most challenging times that anybody could be put in such a high-profile position. I am grateful, I'm humbled by the trust that the Kern County Board of Supervisors had in me as an individual to run a department that played such an important role at such a difficult time. There were many, many challenges, but what better way to learn how to run a department, communicate with our community, implement solutions to major problems that didn't have easy solutions than to be thrown into the fire and do that. And so I spent the last 2 years learning a lot, trial by fire, and I take a lot of those lessons learned and I look forward to using them moving forward. I think one of the most important lessons that I learned is that we can't do anything by ourselves. It takes a village to make major change, and collaboration means everything. And I developed a lot of strong relationships with a lot of agencies in the healthcare field, the school systems, the hospitals, and I'm taking all of those relationships and trying to turn them into how we affect major change in the quality of life and our health outcomes in Kern County. I've also learned a lot about how to run an organization that's under fire, how to really focus on morale of our staff and how to make sure that they don't face burnout, and what we can do to help our staff really find that balance between being productive and working hard, yet also taking time for themselves, because they're going to have more of themselves to give if they take that time for themselves.
So when there was COVID, it was all about COVID 24/7. So what are the critical issues that you're having time now to address, and what is the Public Health Department doing to address these challenges?
There are many issues that we were already facing as an organization before COVID hit, and those issues have now been compounded by the stay-at-home order for the past 2 years, by people putting off preventative health care. The way people access the healthcare system has significantly changed. So we have a lot of focuses that we're revisiting from before the pandemic, but also new focuses. Obesity and chronic disease is number one. We have 71% of our adults that are either overweight or obese, and that leads to chronic disease. And we have some of the highest mortality rates due to chronic disease here in Kern County. So we are focusing on a lot of collaboration with other agencies so that we can start addressing these issues. If you've seen our Grounded in Health 2023 campaign, that's a collaboration between Kern Behavioral Health and Recovery Services and our department. And so we're really trying to educate our community on the basics of living their lives grounded in health, and how mental health and physical health are really intertwined, and you have to address both of them in order to address your overall quality of life and your overall health. So that's a big focus for us. We're also looking at how people are utilizing the healthcare system and really evolving our models for how our healthcare system is run to how it's utilized now. Many people are not visiting their primary care physician any longer. They are calling 911, they're going to the emergency room to seek these services, and our system just really wasn't built for that. And so we're really looking to evolve how our ambulances are responding, what services are available in the 911 system to try to stop people from overutilizing the hospital and linking them to the more appropriate level of healthcare services that they need to address their problem at hand. So we have that also going. We have so much that we're working on. We're looking at health disparities and how certain population groups are more impacted by certain health issues than others, and looking at creative ways to addressing that. Take, for example, Black maternal and infant death rates. They are 4 times higher here in Kern County than they are anywhere else in the state of California. We have Black moms that are dying due to pregnancy-related conditions 4 times more here in Kern County than any other race. And so we're being really creative in how we're addressing that. We've got all other healthcare agencies that are coming together. We have community members that are coming together. And now we have our Black infant and maternal health initiative that we've launched with a strategic plan over the next 3 years to try to address issues that may be resulting in these higher rates of death.
You're quite busy. Let's take a short break for a message from KernTax.
Hello, I'm Kristen Dowd, and I serve on the KernTax Board of Directors. KernTax engages in complex regulatory issues such as utilities and other matters that are of great importance to our community and the businesses that exist here in Kern County.
Welcome back to Conversations That Matters. So Brynn, you were, as we said, you were appointed in the middle of a worldwide pandemic. What is the biggest takeaway that the Kern County Health Department learned from the COVID pandemic? And how is that affecting everything else you do today in addressing all the other issues?
There are so many takeaways from the COVID-19 pandemic, but I think the biggest one is something that I mentioned earlier, that it takes a village, and collaboration and working together is going to greatly benefit our community over us trying to do things on our own. We built so many relationships throughout the pandemic. We were all trying to work together to address different issues in our community. And the beautiful thing about Kern County is everybody wanted to come together and do their part to help. When the vaccine was rolling out, we had over 100 different providers between pharmacies, primary care physicians, urgent cares, all willing to jump on board and help get that vaccine rolled out here in Kern County. There is no other county in the state, with the exception of Los Angeles, which is significantly larger than us, that has over 100 vaccination providers ready to help our community. We saw all of our hospitals come together and truly want to just help make sure that the burden that COVID-19 was placing on the hospitals was evenly distributed, so that not one hospital was set up to fail They were all trying to do their share to help provide that appropriate level of care for our residents when they needed it the most. It was really incredible to see just the sheer involvement and willingness to help that I saw from our community, and we now need to embrace that and move that forward as we try to address other health issues that are plaguing our community. We have so many agencies that are all trying to do their part, but if we do it all together, if we're all trying to address it as one large body, we're going to make substantial change, and our community is going to be able to access these resources much better than if just one agency is doing it alone.
Things certainly have changed. So going through all this, there's obviously what you enjoyed the most. What has been personally the most things you've enjoyed the most doing this transition during this time of crisis with COVID and going into the new world? What is your biggest personal takeaway from all of this that you think that motivates you every day about getting up and going to work?
You know, I truly feel called to make a difference in Kern County, and this job fills my cup. This job is not just a paycheck to me. I feel like I get to go to work and I get to see what issues are plaguing our community, and I get to work with the most incredible team of people to develop different programs and ideas that we can implement in our community to make a difference. I feel like I get to touch people every single day and positively impact their lives, and there is no greater fulfillment than being able to do that every single day.
So when you wake up every morning, what is the thing you don't want to see? What are they? I was like, oh my goodness.
If that's a hard question, there's so many challenges that face our community, and every single day I want to wake up and see great things happening, but that's not always the case. Usually every single day there is a new challenge that has emerged, but I look at that like an opportunity. Bring that challenge back to the office, get a team together. How are we going to overcome this? How are we going to address this? Who do we need to bring to the table? And so while I don't want to see those challenges hit our community, I don't want to see our community suffer, those are opportunities for us to affect change that maybe will positively impact multiple lives moving forward.
So with this said, you mentioned the Black youth infant mortality. What other initiatives are you working on now to try to change the dynamic of Kern County healthcare?
We have so many different initiatives that we're working on. Our Waste, Hunger, Not Food program, that's a food rescue program. If you don't already know, Bakersfield is the #1 metropolitan area in the nation that doesn't know where their next meal is going to come from. So we have the hungriest population in a large city, yet we are the #1 agriculture producing county in the nation. And so Waste, Hunger, Not Food is an initiative that's been near and dear to my heart since its inception in 2018. And unfortunately, we had to bring that program to a close during the pandemic and then relaunch it after the schools reopened and our food donation sites were starting to donate again. We're expanding that because we know our community needs access to healthy, fresh foods. And it's not just a food insecurity piece, but it's also to get our community eating healthier. And sometimes access to food and affordability of healthy food is a barrier for our community. So this program helps to overcome that. Also looking at obesity and chronic disease, we have our Know Your Numbers program, which brings a fitness instructor and a nutritionist into all areas of our community, and it equips our residents with the education and information that they need so that they can live a healthier lifestyle without expecting them to go to a gym or find childcare so that they can go out and exercise, but teaching them how they can do that within their own home. That's how we need to move forward in our community if we expect these obesity and chronic disease numbers to change. We also have, a very difficult topic of STDs disease to discuss, and we're looking at how we educate our community on such a difficult topic to talk about, but something that absolutely needs to be discussed. I mean, we look at HIV, and in 2021, we had more newly diagnosed cases of HIV in Kern County than ever in the history of HIV existing. And so it's something that hasn't gone away, and it's a disease that is actually more prominent now than it's ever been before, and it's something that we have to talk about and address. So we're looking at creative ways to have that discussion and to help prevent these diseases from expanding in our community.
Well, let's take another short break and hear a message from KernTax. I'm Michael Turnipseed. For the past 18 years, the Executive Director of the Kern County Taxpayers Association. Local government agencies must be substantially transformed over the next generation to address the stiff headwinds of changing demographics, regulatory mandates, and structural economic inequalities on many levels. This transformation will require meaningful improvements in public sector productivity, integration of governmental functions, and innovations that produce performance advances that can only come through creative public-private partnerships. Aggressive advocacy from civic organizations like the Kern County Taxpayers Association will be essential for public officials to get and stay focused on these challenges. If you're interested in participating in this transformation of our governmental systems, send me an email at kerntax@kerntaxpayers.org. Thank you for your time. Welcome back to Conversations That Matter. We're with Brynn Carrigan, Director of Public Health in Kern County. Brynn, you talk about all the good things that are happening. What do you appreciate most about the community from your role as Public Health Director?
I think what I appreciate the most is really how I've seen everybody come together and want to help. You know, I keep going back to the pandemic as an example, but that played such a prominent role in my career so far as the Public Health Director, and to see all different county departments want to come together and help out where they're needed, to see, you know, the healthcare facilities and system really come together and want to, you know, help carry their load and make sure that our community had access to healthcare when it was needed, just to see how beautifully our community wants to help each other is incredible to me. And I really appreciate that about Kern County, because I don't think that's something that you see everywhere. I don't think that you see that sense of community, that sense of wanting to help each other in many places, and I truly feel that here, and that's one of the major reasons that I love Kern County as much as I do.
We all care about what health outcomes are, and we have better outcomes in some diseases and not so good outcomes in other diseases. As Director of Public Health, how do you view addressing the outcomes why are some diseases have better outcomes, and why are some diseases not being as successful in addressing the challenges?
It's such a difficult question, because if we had a simple answer to what was leading to higher rates of certain diseases than others, it would be a simple solution, because we would know what was causing it. There are many issues that are really contributing factors to why our disease rates are as high as they are. From our socioeconomic factors that we have here in Kern County, our poverty levels that we have here in Kern County, access to health care. Our county is so large and diverse that it's not always as easy as some would think to access health care. With a shortage of healthcare professionals now post-pandemic, that has become even more difficult. So there's many contributing factors that aren't easy solutions, but what we can encourage our community to do is to follow our website, to follow our campaigns. Our Kern Grounded in Health campaign is providing tools and resources and education throughout this whole year on some of the basics that our community can do to get an overall better health. And there are so many positive health outcomes that come from just exercising regularly, eating better, seeking preventative health care, taking time out for yourself. I mean, it lengthens your lifespan. It reduces your risk of chronic disease. So we're really kind of focusing on those basics, but then we're going to expand from there and really try to overcome some of these larger systemic issues that are plaguing Kern County. So we have a lot of work ahead of us, but I would just really encourage our community to follow Grounded in Health, to follow our website, to seek out that preventative health care, because you know, if you have that doctor that you go to for all of your medical issues, they have that medical history on you, and we can really get to the bottom of the core of what's leading to some of these more surface level health issues. Whereas if you're constantly going to the emergency room or different urgent cares, they don't have all of that background health information on you, and we can't get to the core issue of what is leading to some of these more larger health issues in each individual.
At one time, there was conversation about consolidation of healthcare records. So if you went to an emergency room, they could push a button and pull you up, and they would have your general practitioner's information on you and your history. Did that ever get anywhere?
So there is some medical record sharing. Not every single healthcare facility is on board yet, but it is partially implemented, and there is access for certain players in the healthcare system to access certain records at the hospital level, at the ambulance provider level. So we can see some of that, but the larger, you know, record sharing has not been fully implemented in Kern.
Okay. It's obvious that you have a great personal investment in health and fitness. Tell us about your personal health journey and your fitness journey and what you've done over the last few years.
Absolutely. Well, you know, I've taken it extra serious over the last year. I started my own health journey about a year ago. I am one of those stress eaters, and the pandemic, needless to say, was extremely stressful on my life, and I turned to sweets because I have a sweet tooth and gained some weight, which, you know, has other health implications, as we all know. So over the last year, I have been exercising regularly, eating better, have lost 50 pounds, and have set new fitness goals for myself. I will be running a marathon this year, and it's incredible to experience that for myself. I'm speaking that to our community every single day, and I would be a hypocrite if I wasn't on my own health journey, and so that became very important to me. But I feel the difference. I feel better. I have more energy. I haven't gotten sick in multiple years because I've been on my own health journey, and I truly have felt that eating healthy and exercising regularly has boosted my immune system and has many other positive health benefits on my own life. And so I speak that message to our community with my own personal experience behind it, and I truly believe in eating healthy and exercising regularly as the prescription to overall better health.
I can appreciate that. After a health issue, I've lost 60 pounds, so.
It's amazing.
It's amazing, but it was during COVID though. You weren't going out. You didn't go to restaurants. You just ate at home, and you had better control over what happened. Mm-hmm. And we were on the 0-0-0 plan: 0 sugar, 0 carbs, and which is impossible, but it was a goal, and it was really not that painful. It just happened. And I've seen coming back now the challenges of maintaining where I am, because you go out to events, you do things, and you're eating differently now. And
Absolutely.
So I met to make an extra special effort to stay where I am, which is what I'm trying to do. So thank you very much.
Thank you.
We want to thank Brynn Carrigan, Director of Public Health for Kern County, for attending and participating in today's Conversations That Matter. We also want to thank the Kern County High School District C-Tech video production class, especially Lisa Kirch, their instructor, and all the students that do all the work and make this production possible. Most importantly, we want to thank our viewers for watching and hope you found something informational from what we provided today. Thank you for watching. See you next time.